Hello, everyone. My name is Ayola Ogunjobi. I have the honor to present my assignment 4.0 Asynchronous Group Social Work Conference presentation. And my professor is Professor Sarah Cooker for SWG 614 Advanced Generalist Social Work Practice 4. The treatment group we'll be using is a cognitive behavioral group for adolescents struggling with substance use and emotional disorders in the South Los Angeles community. Um, Purpose. A significant number of adolescents in the South Los Angeles community experience substance misuse and emotional disorders. This has necessitated the need for therapeutic services and support. A considerable portion of these teens in Los Angeles schools engage in alcohol and other substance abuse, with a large number reporting frequent or heavy use. For example, it is reported that 54% of Los Angeles high schoolers are using alcohol, and a significant portion are using marijuana, prescription drugs, and other substances. The proposed support group is a cognitive behavioral group, which is becoming increasingly common in many communities based agencies and institutional settings. Um, the primary goal is to educate and improve understanding about common symptoms, recognize early warning signs of addiction, improve symptoms management, and also enhance relapse prevention, effective intervention, adaptive coping skills, and effective support systems. Additional goals for this group will be to improve insight and promote harm reduction, which enables recovery, reduces inpatient hospitalization, and improves adolescent self-care. The rationale for this group design is to create and expand awareness about the behavioral, medical, and psychological consequences of substance abuse. However, it is also because this group is highly structured and it presents group specific content. The information provided is designed to have a direct connection, an application to the participant. For example, participants are asked to engage in a group activity such as reading and discussing a handout on the potential psychological impacts of alcohol. Summary of Part A and B group proposal. The Part A of the treatment group proposal essentially is designed to support participants struggling with substance abuse and emotional disorders. In this case, the participant will have the opportunity to express their inner emotions and experience in the therapeutic environment. This group will provide support in the form of cognitive behavioral strategies, psychoeducation, anger management, life skills, social skills, and stress management therapy as necessary to suit participants' needs and interests. Part B of this treatment group proposal uses cognitive behavioral therapy strategies to enable participants to learn, identify, and modify unhelpful thoughts, emotions, behaviors, and also to improve their well being. The CBT, cognitive behavioral therapy, for example, focuses on current problems and seeks to establish coping skills and effective mechanisms, procedures, and evaluations. This group is designed to educate and empower 5 to 9 adolescents, who are within the age of 12 to 19 years in the South Los Angeles community. This is to enable them better manage their substance use and emotional disorders. The group meetings are slated for 60 minutes per session once a week, and the duration will be for 10 weeks. A brief procedural description of the intervention strategy CBT being used is as follows. First, the assessment of goal setting. That is, the therapist will assess the presentation of problems by each participant, which includes how participant thoughts and emotions and behaviors affect their life. Second will be the identification of unhelpful thoughts. Participants may be asked to keep record of their thoughts, emotions, and behavior. The third evaluation and procedure will be using behavioral experiments. That is, individual participant will be asked to engage in a particular behavior to test their beliefs and thoughts. Fourth is to engage in skills training. Here, the individual participants are taught healthy coping skills to manage difficult emotions. And fifth will be maintenance and relapse prevention. That is, participants are taught how to maintain gains. The sixth will be therapists, and participants will review progress regularly and consistently to make necessary adjustments as needed. Seventh, both therapists and participants will discuss termination process of treatment and also agree on developing sustainable plans for ongoing support. And the success of this objective will be evaluated, which is through using a blend of pre and post group assessments to generate baseline data. This is accompanied by using questionnaires, skills, structural interviews to assess individuals' current thoughts, emotions, and behaviors in relation to the objectives of the group. The second method of assessment and evaluation will be the success of the group through kind of goal setting. This one discussed that both therapists and participants can collaborate to develop measurable goals that align with group objective. The third method of evaluation used for this group is to conduct a post-group assessment by replicating the assessment to measure the degree of change in participants' thoughts, emotions, and behavior. And the fourth method is to, absolutely solicit feedback from participants about their group experiences by facilitating group discussions, ongoing monitorings, and regular check-ins. And this would include focusing on measurable outcomes such as reduction in substance abuse and emotional disorders, increased engagement in sobriety, and improved healthy coping skills using self-reports skill tools like behavioral observations, questionnaire, and group feedback. Thank you so much for your time and for listening.